The Physical Mental Wellness Foundation has called on the federal government to increase current budgetary allocation to the health sector in order to reposition the sector. The chief consultant cardiologist of the Defense Medical Center says that Nigeria loses about 1.4 trillion naira annually to medical tourism, thus the need for reforms of the health sector in the country.
On average, according to Bureau for Public Enterprises, Nigeria loses about $1 billion US. That is 1.4 trillion naira annually to medical tourism to these other countries, India, US, UK, Turkey, name them. The federal government and the state government have to declare state of emergency on healthcare delivery by increasing budgetary allocation to more than that 15%. There are countries budgeting 20%, to fix all the decay infrastructures, increase supply of commodities to the hospitals, and payment of living wages to the health personnel. Part of the reason they are leaving is the wages are poor and they are working in a very poor, dilapidated environment. Then government at the center and state must develop the political muscle, political will to stop all government-sponsored medical tourism. Last year, our former president, from 2015 to 2019, he spent over 300 days on medical tourism. We are not given the cost, but you can imagine what the cost it cost this nation.
The operation of medical tourism will naturally fix the challenges within the healthcare sector, but the transformation cannot take place in the absence of enabling environment. Our solution begins with enabling environment as it paves the way for effective operation and intra-borne domestic and inbound medical and wellness tourism. What that means is this. If, for example, you're here in Abuja, in terms of intra-borne, inbound, you can actually go to Castina, you can go to other parts, even if you're not the indigene or you're not the indigene of that place. Irrespective of that, you can go there, you will receive access to good healthcare without discrimination. You have every right just as every other person. A hospital should not be too far from people. It should be within district. Do you know, based on our population, at least every district should have a primary healthcare system that is accessible, so that before you get to the secondary or tertiary healthcare system, you're already being attended to. But unfortunately, minor things, you go to some community, you hear things like in Hausa, saying, Naji, I have gone too far, the hospital is too far. People are dying, diseases are out of control, drugs sometimes is even expensive. We have 4 ways that we can actually make this happen. Restructuring the healthcare system, we upgrade the healthcare system, quality assurance and accreditation, and also promotion.
Our main goal is to position Nigeria at the forefront of medical and wellness tourism in Africa. The less privileged people cannot afford healthcare. We know healthcare is expensive everywhere in the world. But if you look at day in, day out, many of our citizens, whenever they're sick, they go to local hospitals. They go to some of mostly public hospitals because many cannot afford private hospitals. Most of our policies on healthcare generally does not support healthcare advertisement, simply because government sees healthcare as a non-profit making venture. So I don't know, maybe many of you may not even know that in Nigeria healthcare we cannot advertise. And the funny thing is that you may have good hospitals or good doctors close to your house, and you may be dying in silence because it's not allowed to promote, you may not know.